So hiya, I'm Viv. I'm the face behind Skinpharma Aesthetics in Stockton, and I get a lot of questions about lip augmentation treatments from clients. So I thought I'd answer some of these with a video. And I've got a friend and a colleague called Claire Shaw from Butterfly Aesthetics in Wakefield, and she's very kindly agreed to answer some of the questions with me. So I'll let you have a word with Claire. Here's Claire.
Hi everyone, I'm Claire, and I'm the owner of Butterfly Aesthetics.
Great. Anything to do with your work and what you do, Claire? What sort of stuff do you do?
Well, I've been in the NHS for 23 years. I've recently left the NHS, although I do pop back in from time to time to do the odd shift, but mostly I'm full-time in aesthetics now. I've just recently completed my independent prescribers qualification at Huddersfield University, and I think I'll stop there with the studying for now.
Right, fair enough. Would you say you get a lot of lip augmentation questions more than any other treatments that you do?
Yes, definitely. I think lips are definitely my niche. I do enjoy doing other treatments, and obviously I am trained to do other treatments, and I like to think that I do those well, but lips is definitely the big part of my business for me.
Great.
I'm guessing it's the same for you as well.
Yeah. The thing with lips is it's not an easy treatment, I don't think, to do unless you've got a lot of experience and a lot of knowledge and skill to do it properly, because so many people do it, and I see a lot of botch jobs, unfortunately, and I'm sure you do as well. And I think a lot of the problems with lip treatments is to do with people just not feeling comfortable about getting them done because of problems that other people have had and things they've seen on social media, etc. But you've trained to quite a high degree. I personally think you're probably one of the top lip augmentation specialists in the UK. Now, you probably don't think that, but I do.
Very kind.
But give us an idea of where you've trained, Claire, just like a little bit about where you've trained.
I started off with my my basic training at Skin Viva around about 4 years ago. So that was your basic toxin and filler. And then I went on to Derma Medical and did a lip masterclass with them. Since then, I discovered Julie Horn over in Oslo had an academy. So I invested quite a lot of money and time, obviously, to go and visit her over in Oslo and spend the day with her. Not only was it myself, it was injectors from all over the world, so it was international, so it was really interesting to meet other practitioners. I've also done some training with Dr. Lip Beauty, and he's over in Rome. He's a very well-known plastic surgeon. Again, he's amazing at lips. And I wanted to learn from these people because I love the way that their lips are really natural, and they give very beautiful, subtle results. And that's what I want to try and achieve. I personally don't like the big rubbery duck lip. I think it can really ruin a person's looks. And I see a lot of it about, unfortunately. So I like to think that my niche is the natural lip augmentation.
Great. So we both love doing lip augmentation work. It's my favourite treatment without a doubt, and I'm sure it's yours as well. I'm sure you prefer doing those above any other treatments that you do.
Definitely, yeah, I love it. I really am very passionate about making sure that I do a good job with the lips, because it's amazing how it can change a face. It's also amazing how it can influence other people, you know, your confidence as well, just by a really, really subtle and natural augmentation.
Great. Okay, so what we did, we posted on Instagram, and I posted on Facebook as well last week, to ask followers any questions they had about lip treatments in particular. So we put together the questions that we've had, and there was quite a few different types of questions. So what I've done, I've organized them so they're in different categories. So I've put them together. I'll just get that up. I'll be 1 second. There we go. So I've put them together in 3 different types of questions. So we've got pre-treatment, we've got questions to do with in treatment, questions about what's involved during a treatment, and also questions about post-treatment. So what I thought we'd do, we'll go through some of these and then we can talk about what we think to do with the answers to these questions, Claire, if that's all right with you. So first question, what's the best advice you can give about getting a lip treatment, would you say, in terms of...
I think we probably both agree on this one, that you have to make sure that you go to somebody medically trained. It's important to do your research and find the right person. I would also say that there are very, very many practitioners, and particularly non-medics, that are advertising themselves as an advanced aesthetics practitioner. They'll say they're masterclass qualified, registered and insured. Well, not the registered, they'll say they're insured, sorry. And that can sometimes fool people because they like the words and they think, oh, they must be good if they've done all this. But really, anybody can call themselves that. So I think the key to that is, don't just make a natural assumption that if you see advanced practitioner or masterclass trained, that they are medically qualified. I think that's the most important thing that people should be asking. Do you have a medical background? Are you able to help me if something goes wrong? Are you able to help me if I have an allergic reaction? They're the sort of things that people need to be looking at, not just pictures and words on Instagram. We all know there are non-medics out there, and I'm not here to slate non-medics. I actually see some good work from non-medics, but I think ultimately you need to make sure that somebody's able to help you in the event of an emergency. Or if something goes wrong a few days later, you need to make sure that somebody there is available to help you, and swiftly too.
What about in terms of the cost? I've always said you get ultimately what you pay for, because you see adverts on Facebook and Instagram all the time, cheap lips, offers, share with a friend, etc. Pay 50 quid, 90 quid, whatever, and there's the people that are doing those treatments can be absolutely anyone. There's nothing to guarantee they know what they're doing, and I see that a lot of the time, and people say to me, I went somewhere, got a treatment, not as good as I expected, and it cost me 50 quid. And I guess you get the same problem with clients, same thing to you. Ultimately, I think you get what you pay for in terms of treatment.
I think, I'd have to agree with that as well. You do get what you pay for. You're not just paying for the product, and people see, oh, £50, that's really cheap. But they're not looking at the bigger picture. What you're really paying for in your whole treatment is you're paying for the practitioner's time, their expertise, the amount of time that they've invested in training, and you're also paying for aftercare as well. So if anything does unfortunately go wrong, then obviously you are paying for access to that practitioner in the event of that happening. So it's not just a case of, oh, that's a good price, 50 quid, that's nothing. You really do have to consider other factors around that as well.
Okay, let's just go on to the next one. Age, client age. What do you feel about under 18s coming to you for treatment, or clients of different ages? Basically, what would you say? I'm sure you've had problems with like 17-year-olds or clients that say they're 17 and maybe a lot younger than that say they've got like consent from the parents to have treatment. What would you say to them, Claire?
It's something I get asked about a lot, actually. I get a lot of 17-year-olds that are coming up to their 18th birthday. They've been asking if they can book in before they're 18. They've got a letter from the mum or the dad, or they're willing to come with them and consent, I'm afraid it's an absolute no-no for me. My insurance itself does stipulate that a patient has to be 18, so I will turn people away. I'm also very cautious with 18-year-olds anyway. Even if I did get an 18-year-old present, I always check their ID, and you know, I will ask a lot of questions and do a really thorough consultation to find out why they want it doing, because I sometimes find that a lot of the young girls, and I'm not particularly pointing out young girls, but I do find that they tend to be just jumping on the bandwagon because their friends are having it done, or their older sister, and they look really good. So they might not necessarily have a real personal issue with their lips, they just want it doing for the sake of it. So if it's somebody like that, I'd really want to question it a bit further. But definitely, in answer to your question, I won't treat anybody under 18, and I will happily turn them away.
Great.
Okay. Do you do that as well?
That's exactly what I do. Under 18 is classed as children, they're not classed as adults. So legally, we would end up in a lot of problems if we treated a non-adult. So yeah, same reasons as you. So another question, do I need to do anything before a treatment? You sometimes get questions from clients, never had treatment before. They're not sure whether they need to do anything, or, you know, they might be on medication, etc. Do they have to do anything? Do you see clients in that position?
You've gone off.
You've
gone off, that's it. I will always, do you actually mean sort of before they come through the doors, or?
Yeah, it's sort of like what they might think, you know, they can go out for a good drink the night before, or they can they can do certain things beforehand, you know, like, you know, about alcohol, problems with alcohol and bleeding, etc. There's different.
So I do advise not to go out drinking the night before, definitely, because obviously it can influence the amount that they bleed as well. I don't particularly want them coming and having treatment if they're hungover, because that can present problems itself. You know, but I also will discuss if people suffer with cold sores and things like that, because if they suffer with a number of cold sores per year, then there might be a reason that we might want to give them a prophylactic treatment before coming. So whilst you don't have to do anything specific, then I do advise those things. Obviously, if people are on certain medications such as blood thinners and things like that, then we don't want them stopping them, because that puts them at risk of other issues. So we're just trying to find out a little bit about the person, really, and, you know, we'll ask them if they're on any medication, and we'll discuss that with them thoroughly. Pre-consultation, sometimes we will do on people who are not quite sure, or have got lots of questions or existing health problems, then we will obviously speak to them about that. But anybody who's normally fit and well, not got any issues, no medical history, it is a case of making sure you don't go out and get drunk the night before, ideally. And also try to come to clinic with no makeup on as well.
It's like just the makeup does cause a bit of a problem in terms of cleaning the face and being able to inject properly without risking infection. So yeah, you must see quite a bit as well, I'm guessing. Right, let me just get that up. So clients that come in like for the first treatment ever with lips, they're not sure what to expect, you know, they're not sure, will I just shove the full syringe of filler in? Do they have a choice? Can they ask me what they'd like me to do for them? They've got no idea. So what would you say in terms of being able to offer them different types of treatment when they ask for the lips to be done, Claire?
So when you come to my clinic, I do my consultation and tell them, advise about risks, side effects, what to expect from the treatment. And really, kind of just before we're about to start, I will always ask somebody why they've come to me and what their intention is and what they want out of the treatment. So I don't just lay somebody back and start sticking needles in them without them having told me what their issue is or what they want to try and achieve. So I'll always be really honest with somebody. So if somebody with really, really thin lips comes in with a picture of somebody who is a supermodel and they've got a natural, gorgeous lip shape already, might not even be enhanced. It might be, they might be fortunate enough to have that themselves and they're asking for that. Yes, you can request it, but it's very, very unlikely that we're going to be able to achieve that. Because they'll have a different lip shape and different facial features and things like that. So I will always ask somebody what they want first, because we need to make people aware that some things aren't achievable and there are things that we can't do. We're not using a magic wand. And also, what I do find is patients will often come with the expectation that they'll just need one treatment and wham bam, they've got the most amazing, beautiful lips ever. So again, that's something that we need to be very honest about and say, look, if you're trying to achieve this amount of volume, yes, we might be able to do that eventually, but no, you're not going to get that today. You're going to have to invest a little bit of time and money into achieving that, and it's going to take a couple of visits. So I will tell people, you know, I will say to them quite honestly if I can or can't do it, and then I'll give them the opportunity to leave the clinic if, you know, if they feel that it's not something they want to invest in.
That's good. Let's have a look. Could I be allergic to the filler? I get some clients that are very nervous about, you know, possible risks with having the filler injected. I tend to do a patch test on every client that I've not seen previously with whatever filler I use. So a small amount of filler just dropped onto their onto the back of the wrist. Let me just get myself up. Small amount of filler just dropped onto the back of the wrist. It can cause a reaction quite quickly within about 30 seconds. I do that just to minimize the risk of a sensitivity problem, you know, should the filler be injected directly into the lip. Never yet had a problem with it, but it's just in case, minimizing that small risk of it happening. That's what I tend to do, just to minimize the problems later. It's just for safety. I'm sure you have that same problem and questions being asked by some of your clients about risk to do with the injections beforehand.
Definitely something we speak about in the consultation, risk, side effects, etc. So it's always something that I mention to somebody. I don't particularly patch test everybody. I will patch test somebody who may have had a previous reaction to something, or if I suspect that they might have a lot of sensitivities about different things, then I will patch test them at that point. But I don't do it routinely. I usually feel like I might get an indication if they have an allergy to the local anaesthetic that we put on the lips. So I usually like to feel that if they're okay with that, they're probably likely to be okay to the filler. But as always, you know, that's the beauty and the necessity of going to a medical practitioner, because they will have the emergency medication and kit to deal with such an event.
Okay.
So
great. Get the next one. I think you've gone through this already. How can I be sure about the person treating me? You've mentioned about checking on the person's background, healthcare professional. I think we've gone through that already, haven't we?
Yeah, definitely.
Okay.
I don't think people should be scared about asking. I get people ask me, and I'm more than happy to show them my credentials. They come into my clinic, my certificates are all on the wall. You should ask. You should ask, and I actually find it quite refreshing when people do ask me, because I think, you know, you're really doing your research, you're asking the right questions. And if anybody you know, gets no, if any, you know, people shouldn't be worried about asking, and people shouldn't be nervous about responding to it either. So I think you should definitely ask people, and there's no harm in it whatsoever.
Okay, let's get the next one. Right, lip flip. I don't tend to do this very often because there's some issues with it, but lip flip, I'm guessing people know about fillers for lips without any problem, but there's other types of treatment that can be carried out on the lips, and one of them is called a lip flip. it involves toxin. I'm not going to mention any brand names or anything, but it involves toxin into the area of the mouth where the muscle is around the lips, and it can produce a flip. I don't know if it's something you do or that you talk about, Claire.
I've done it a few times and I have had fairly good success with it, but it's probably not something that I really promote.
Yeah.
Because what I have found with it is the side effects of the toxin can often give you undesirable results.
Yeah.
I've even had a little play and done it myself just so that I could feel what it was like.
What was it
I
like?
didn't like it at all.
Didn't you?
I found, and I only did, very, very, very low dose, but I just wanted to see what it was like. I found with it that I struggled to pronounce my P's and B's without having to really think about it. And I felt extremely self-conscious about that as well, especially when I'm doing face-to-face consultations really closely to people.
Yeah.
I just felt as though I had to really concentrate on my talking. It only lasted that long for about probably 2 to 3 weeks,
Yeah.
but I was really uncomfortable about it.
Yeah.
Other people do report not being able to sort of purse their lips very well, very similar to sort of treating smokers' lines and things with toxin.
Yeah.
I found the benefits don't really outweigh the side effects from it, really. So I don't really talk people out of it, but I will tell them about my experience of it. And most people kind of go, I don't think I want to be like that for a few weeks, especially if they're in the public eye or having meetings with people, front of house in their job. They don't want to be feeling self-conscious and covering their mouth up, which is what I did. So I won't be doing it again.
that's fine. Right, gone through this already. If I show you a photo, can you make my lips look like that? It's the same as before. Everyone's individual. You wouldn't want to change someone's face to make them look like someone else when they don't need it, and you can't just do that anyway. And you've gone through that already. But do you see that quite a bit? Pictures off Facebook or Instagram brought in, and someone says, "Can you make me look like that?" Sure.
I do, and I do get people come in that have screenshotted pictures of my work as well, and say, "Oh, you did these lips on such and such a person," and I really like that. So, I will happily have a look because it gives me an idea of what that person's trying to achieve, and in turn, that's my opportunity to be honest then as well. I'm not the type of practitioner that will promise something and not be able to deliver it, because it's not fair on them. That's likely to cause me grief as well in the long run, so I just don't do it. So yes, it does happen, and I will just obviously say to somebody, look, they've got a different shaped lip to you. Your lips are a lot thinner or a lot smaller or a lot bigger or whatever. They've got different size mouth. And what people also don't realise is we do have to take into account their other facial features as well. You don't want to give huge lips on somebody who's got really small, petite, delicate features, because they're going to really stand out. And also, if you start making lips project further than they should be, then it can alter all other aspects of the face as well. So you've also got to take into account people's side profile. I'll always look at the side profile. I don't just look at the mouth and the lips. I look front on, sideways, everything. I take everything into account. So they're the sorts of things that a lot of people don't consider. They just come in and think, I want my lips doing, and bring you a picture. And sometimes you just have to be honest and say, yay or nay, we can or can't.
That's fine. Let's see what else. Sometimes I get cold sores. You mentioned a bit about that. Cold sores can be a problem in certain individuals, those that particularly have had treatment before and have come out with cold sores. But I'm guessing you've specialised in work to do with this, I think, in part of your prescribing course, haven't you, Claire?
I did, yes.
So
I did choose to do one of my case studies on cold sores in aesthetics. So obviously it's a given that if somebody presents with a cold sore, then they can't have treatment. they can't have treatment anywhere on the face, whether or not it's toxin or anything. I just won't treat them. It's just a risk of infection. But if somebody is prone to cold sores and gets a couple of cold sores, several times a year, then I think it would be wise to give them a course of medication before having the lip treatment, and it will cover them for before the lip treatment and for a few days afterwards as well. But if somebody just got one cold sore a year, I'd probably, just say to them that it is a risk. There is a possibility that having the treatment, you could develop a cold sore. But obviously I would expect them and I would ask them to contact me in the event of them getting any sort of blisters, vesicles, tingling, early onset. One thing that I always ask people to do as well, I always ask them to contact me if they feel like they're getting a cold sore anyway, because having blisters on the lips can be an early sign of other problems. So I wouldn't just like to make a natural assumption and say to somebody, oh, sounds like you've got a cold sore, go to your doctor, or pop in to see me later when you can. I would always ask a lot more questions around it and get them to come in if I had any concerns, because I don't just want to make an actual assumption that it's a cold sore and something, far more sinister that we would need to act on quickly.
So clients basically, they can trust individuals like us, to be able to look at not just their aesthetic treatment, but to look at everything around having it done as well. Which is one of the reasons for going to a healthcare practitioner after all. Right.
Definitely.
Okay.
I think if somebody's got a cold sore, so if somebody suffers with cold sores and they contact you after 24 hours and say, I've got all these blisters on my lips, it would be very easy for anybody to make a natural assumption, oh, it's because you've had your lips done, therefore you're probably getting a cold sore. But you have got to think about other things and think outside the box sometimes, and I think that's where it's important that you can't just make that you can't just make that natural assumption that that's what it is. You have to consider other areas as well.
Okay.
Definitely.
Great. Let's just see what else we've got. I see posts about someone doing offers, sharing a meal with a friend. Is it worth it? I'm sure I know what you're going to say about that.
Yeah, that's something I get asked quite a lot. Yeah. Unfortunately, people are very driven by money these days and going on cost of things. And we've obviously had this conversation about your 50 quid a mil filler and things like that. People will ask if they can share a syringe with their friends to make it cheaper. That is an absolute no from me. It's a huge risk of infection. It's just not something that we advocate or we practice at all. Syringes of filler are for one time only. So once that has been taken out of the packet and used, it's not going to be sterile for use on even yourself. So, some people also ask can I have half a mil today and then come back in 4 weeks and have the other half? I want to buy the mil because it's cheaper. To do it that way, again, that is a no from me. Once you've used it, if there's any left, it goes straight in the bin. You have to practice sterile treatments.
Okay.
Same for you, I guess.
Yeah, exactly the same. I wouldn't reuse the same treatment for even the same person. I certainly wouldn't share any treatment with anyone else anyway. So yeah, exactly the same. Can I have lip fillers whilst breastfeeding? Somebody asked. So I'm guessing you. I don't tend to see many clients that have been breastfeeding, but for me, no, it's just one of the contraindications for treatment, unfortunately. Pregnancy and breastfeeding, both reasons for not doing lip filler treatments and any other aesthetic treatments as well. So I'm guessing that's the same for you as well.
That'd be the same, yeah. I won't treat anybody who's pregnant or breastfeeding. And I always make sure I ask as well.
Yeah. Okay. Last question about pre-treatment. Someone lives in Leeds. Where should they go to get the lips done, Claire? Now, I thought It depends how far away you are from me and Claire. That's what I would say. You've got a short journey across the Transpennine up to Yarm, and I'm not far north. And then you've got Claire south in Wakefield. So I basically say go to either one of us if you live in Leeds and want your lips doing.
And I'm also opening up again in Leeds as well in July. I am, so I'd say come to me in Leeds.
All right. If you don't open up in July, they can come to me and they live closer to me than come north instead of south. Then is that all right?
Yes, cool.